Hi, I'm Ryan Mutter, and I'm a principal analyst at CBO.
And this is Noelia Duchovny. I'm a principal analyst in CBO's Health, Retirement, and Long-Term Analysis division.
This is a presentation that provides an overview of CBO's report, how CBO analyzes approaches to improve health through disease prevention. Disease prevention is a subject of considerable interest to policymakers, healthcare providers, payers, and patients. Preventive medical care includes services that can prevent diseases from occurring, such as vaccinations, and services that can detect a disease before symptoms appear, such as screenings. Such medical services often have beneficial effects on people's health. Because those services would identify and treat diseases early on or prevent them entirely, people might expect that their expanded use would lower healthcare costs. But the evidence suggests that expanded use of preventive medical services generally has led to higher healthcare costs, not lower, which might seem counterintuitive. This presentation summarizes how CBO analyzes federal policies related to preventive medical services and includes a discussion of the effects on the federal budget of a vaccine for the coronavirus. Although CBO's mandate is to provide information about how a policy would affect the federal budget, cost is just one of many factors that lawmakers may consider when weighing the merits of legislation. Certainly, policies that would increase healthcare costs may be considered worthwhile if the expected health benefits are significant. As I mentioned earlier, the evidence suggests that expanded use of preventive medical services generally has led to higher, not lower, healthcare spending. According to a comprehensive review of the research literature in 2008, most preventive medical services improved health, but only about 20% reduced costs, and the remaining 80% led to higher healthcare spending overall. A 2014 study by the Government Accountability Office supported those findings. There are a number of reasons that CBO's estimates of preventive medical services may not show savings. First, savings come from only a subset of people who receive the services, from preventing diseases or identifying and treating them early on. Second, even when the price of a particular service is low, costs can accumulate when many people receive it. When that occurs, the number of people for whom there are added costs may be much larger than the number of people for whom there are savings. Third, services can have unintended costs, such as adverse reactions to vaccinations and false positives from screenings. Fourth, services may increase patient longevity, resulting in people living longer and potentially incurring treatment costs for other medical conditions.
Thanks, Ryan. The effects of preventive medical services on the federal budget may differ from their effects on overall healthcare spending. The direction of the change is often the same, but the effects on federal healthcare spending tend to be smaller because the federal government does not pay for all healthcare. CBO's estimates also account for whether services are already being used under current law. For people who would have used the service to the same extent under the proposed policy as under current law, additional government support might just shift costs of the service to the federal government, but provide no offsetting savings or health improvements. Because of congressional budget rules, most of CBO's cost estimates span 10 years, so they do not capture the effects of a preventive medical service beyond that period. If a longer projection period was used that would capture some savings in later years, it also might include more costs if policies resulted in gains in longevity. CBO analyzes the effects of policies on the federal budget on a case-by-case basis, and we have estimated that certain preventive medical services would in fact reduce federal spending. For example, CBO estimated that covering tobacco cessation services for pregnant women under Medicaid would decrease federal spending for that program because it would lessen health problems among the babies, which would more than offset the costs of providing the tobacco cessation services. However, we also estimated that expanding Medicare's benefit package to waive cost-sharing for the Welcome to Medicare visit and include a new annual wellness visit with no cost-sharing would increase federal spending. We concluded that the cost of providing those services, including the cost of any recommended follow-up testing, such as screening for diabetes or heart disease, would exceed the savings from any diseases that were avoided or detected earlier. Lastly, CBO's report discusses the budgetary implications of a vaccine for the coronavirus. Those effects could be substantial. A widely available vaccine could have major macroeconomic effects, such as a faster rebound of economic activity, leading to less spending on unemployment benefits and Medicaid, as well as increased tax revenues. In analyzing legislation related to a vaccine, CBO would consider many factors, including how a proposal would affect whether and when a vaccine was approved and widely available, the scope of the pandemic when the vaccine became available, the characteristics of the vaccine, and the extent to which mitigation measures and social distancing influenced economic activity. By long-standing convention, however, effects on the economy overall generally are not included in CBO's cost estimates for legislation. For more information on how CBO analyzes approaches to improve health through disease prevention, please see the report in CBO's website.